Oh, good morning. I can't hear you.
Can you hear me now?
Yes, I can.
Okay. What did I do? All right. Well, we good. Good morning.
Good morning.
How are you?
All right, yourself?
I'm well. I'm well. How you been?
Good, good. Can't complain. How about yourself?
Same, same. It seems like it's been forever, forever.
Hmm.
All right, all right. So let's see. We done had all kinds of stuff going on here. It's been a week of birthdays. My house birthday was on the 9th. My son's birthday was on the 10th.
Okay,
The grandbaby turned 7 months on the 11th, and my
okay.
daughter's birthday is today. So
Oh,
we just birthdaying it up. We birthdaying it up. Yeah, yeah. So what's going on in your neck of the woods?
nothing. No, the only thing I'm celebrating is I can finally put my trash out on Monday night. The strike is over.
Oh my God. How long did it last?
I think nine days.
Oh, good Lord. And it's
And
hot. That's bad.
And I mean, well, they started because I think they announced the settlement Wednesday. So Thursday they started. I mean, it was trash everywhere,
Oh
all
my
all up and
God.
down the street, just lots full. So they have been cleaning that up. Then they're going to start regular service on Monday, and my day is Tuesday.
Okay. Okay. Well, I know that's it. I know y'all relieved about that. Good Lord.
I was like, man, look, I wish I could go back in the day because my grandmother, they lived in Maryland on the Eastern Shore. They would take their trash out into the field and burn
And
it.
burn it. Yeah. That's like they do down in the South. Burn it. Be like,
Hmm.
burn it up, burn it down, burn it down. Wow. Oh, well, I'm glad that's over for you. That
Hmm.
could be a mess. Craziness, craziness. All right, all right. Well, I'm excited. It seems like forever.
Yep. And it's a lot. It's always something going on, especially
Sir,
now.
I felt like really now that I'm not seeing the people and we're not talking, really, this is what's happening. It's
It's
yeah,
crazy.
crazy foolishness. All right, well, let's get into welcome everyone to our Saturday morning tea. Here we brew up the hottest topics in healthcare. We discuss health information, news, education, certification tips, birthdays, garbage strikes, but the happiness about being able to put it out. And all of the things. Also, entrepreneurship and the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I'm the Girl with the Pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask, do you know what it takes to be a certified marketable medical coder? Do you? Well, before I introduce my co host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, I done been gone and StreamYard done added all kinds of little buttons and stuff. I'm like, what is this? I feel like a kid. So, if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. Joining me today is my partner in success, my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been in healthcare for a very long time, 3 decades. And in 2014, I left the bedside and dabbed my toe into risk adjustment and HIM. And during the pandemic in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how is that going?
It's coming along, but I really
Okay.
feel like I say the same thing all the time, just to different people, because the message is not getting out there about what HIM is. Like it is there's so many misconceptions.
Mm.
It's just craziness.
Hmm. Yeah. Folks, yeah, you're right. You're right. Because I swear to God, if I hear, I want to be a biller coder one more time, not that they don't
Yeah.
exist. There's
But
plenty
people
of y'all out there in the world, but to
they don't know the
understand the
difference.
nuances between the two. So yeah, yeah, bless their hearts.
Yes.
Like, because you got to have some strong skills on either side of the fence to do the jobs well. So yeah, yeah, yeah.
I mean, in anything you start, you have to know what you're getting into.
you know, wait a minute, we about the whole pivot the whole show. It's amazing to me that people really just don't know. Like, and I'm trying to think back, because I'll think back to when I started, and it was new. But once I did the research and looked things up, like, oh, okay, I can see, what this is about, and I was all in. Like, okay, well, let's do this. This is what I want to do. Until I learned about something else, and then then I pivoted again. But um, a lot these people just it's what I hear usually. If the folks are in healthcare, then it's a different conversation. I'll say that. But if they're just hearing about it on those nighttime TV infomercial things, they they don't really have a clue, and they just like, oh. So when I explain it to them, like, so you do go to the doctor, right? And when you go to the doctor, I give them the whole, oh, so that's what we do,
Well,
and then some.
I have conversations with people in healthcare, and they are completely clueless.
I mean,
Completely.
like revenue cycle folks who are trying to transition over. Those conversations are different than
Okay,
somebody
yeah.
that's complete. That's what I meant. I'm sorry.
Okay.
Somebody who is like a respiratory therapist don't know what's happening over here. So,
Mm-mm.
mm-mm, mm-mm. And then I thought, well, that's a whole other conversation. I'll say that for the meeting after the meeting. All right, all right. So before I jump in, let me remind you that you can join in and add to the conversation as well. Talk to us. Don't be shy. Your opinion matters and is welcome. So, friends, please use the chat. And if you have a question, please type Q first so we know it is a question for us and we don't miss it. So, for those who are just joining us or watching the replay, today we are talking healthcare fraud alert, $14.6 billion takedown and your risk. Woo, child. But first, let's get into our church announcements, shall we? Shall we? Shall we? You're gonna have to hold it up for the people. As you see, I am not in the studio.
Yes.
There we go. Hey, I should have packed it. I don't know why I didn't. I packed everything else pretty much. I can double clap though. Uh,
Well, look, we gonna have to resurrect him because you know they talking about changing voting laws. So
Lord. I might put Malcolm on the next one. Don't
there
play.
you have Malcolm.
What you about
Uh,
to do? You was about to speak in tongues.
look, Huey P. Newton. Oh, listen,
Somebody. Lord. Jasmine Crockett. I could put her on there.
I'm telling you, they gonna make us pull out the Ouija board.
Lord. All right. So I just have one. The quarterly, and I think I talked about this before or maybe it was to the Patreon folks. I don't know. But anyway, the HIC picks they're updated quarterly. Well, the quarterly update for July has been released. Their new, revised, and discontinued codes and modifiers is something that happens quarterly, which I didn't know. That was something I learned at it was a CPT, it was some kind of CPT webinar thing from the AMA, which was very, very insightful. I had a great time there. It was well worth my time, and it was free. But anyway, but I didn't know anything. I didn't know about HIC picks being released quarterly. And I need to research to find out when did that start, because that wasn't always the case. But anyway, everything is effective July 1st. There were 25 new codes, mostly injections, mostly J codes. 2 codes, also J codes, were changed, and 8 J codes were discontinued. Check out the CMS or your local MAC websites for more details. But yeah, those things were released. That's all I have. Miss Jessie, you have any?
No. I'll wait till we get into our topics. Yes.
Okay. All right. Well, let the tea spilling begin. Let's see. Make sure I got everything. That's everything. Stuff's supposed to be where it's supposed to be. Okay. Again, welcome back to the Saturday Morning Tea. I'm Clarice Warner, the girl with the pearls, with my partner in success, the coding nurse. And I hope you've got your favorite tea brewing because, whew, when the Department of Justice drops a $14.6 billion bombshell on our industry, we definitely have to talk about it. And let me just credit our team, because we were seeing all kinds of stuff and we sending stuff to each other like, did you see this? Did you see this? Did you see this? So our on-street correspondent, the crafty coder, sent us something, even though I think we both saw that one at the same time. Mr. Jesse had one. I had another. I mean, we just like, it was like, bam, bam, bam. Like, it was craziness this past couple of weeks. So we wanted to bring all of the information to you. So make sure you get your tea. I know I got mine because some of this made me nervous though, but we'll get to that. Because what we're about to share with you is going to reshape how we think about compliance, billing, and risk management in healthcare. And again, while most of us were focused on our day-to-day operations and our day-to-day tasks and duties and that productivity, 3 major stories broke that demand our immediate attention. Again, today, we're going to break down the largest healthcare fraud takedown in the Department of Justice history, examine why UnitedHealth's troubles should concern every single one of us, and understand how surgeon payments are now squarely in the crosshairs. They need to tighten up. More importantly, I'm going to give you practical, actionable strategies to protect your providers and organization. You know what? It could all be so simple if we just focus on doing the right thing, documenting properly, and putting patients first. So let's dive in. First, this massive scale of healthcare fraud. So let's start with the numbers that should make us all sit up and take notice. So on June 30th, the Department of Justice announced the largest healthcare fraud takedown in their history, 14.6 billion. We're talking 300. I have never seen anything in my entire career. 324 defendants, including 96 licensed medical professionals across 50 federal districts. Mr. Jesse sent this over to me. I said, well, wait a minute. What? All I sent back to him was, wow. I had to stop what I was doing and comb through it. And then I had to look at it again. I had to read it twice. The previous record was 6 billion. So they have more than doubled that. That tells us something significant about the scope of fraud in our industry right now. And what's particularly concerning is the sophistication of these schemes. They're getting better. It's crazy. It's crazy work out here. And we're not talking about simple billing errors or coding mistakes. No, they done gone way beyond that. These are organized criminal enterprises using artificial intelligence to create fake patient consent recordings. Consent recordings. They're exploiting stolen identities of over 1 million Americans from all 50 states. One scheme alone involved $10.6 billion in fraudulent claims for durable medical equipment. Now think about that, $10.6 billion. That's more than some states' entire Medicaid budgets. Now, if criminals can organize to this degree, what does that say about the vulnerabilities in our systems? More importantly, how do we, the legitimate providers, ensure we're not inadvertently caught up in these enforcement sweeps? But the Department of Justice specifically highlighted transnational criminal organizations with foreign straw owners, people being sent into the United States from abroad using encrypted messaging from overseas. Again, this isn't your typical healthcare fraud case. This is organized crime targeting our industry. I guess sooner or later it was going to get to us, right?
Mhm.
With all the stuff going on. The key takeaway is that fraud detection has become incredibly sophisticated. The DOJ's new Healthcare Fraud Data Fusion Center is using cloud computing, artificial intelligence, and advanced analytics. They're not just reactive anymore, they're predictive. And that changes everything for how we need to think about compliance. So, you know what, though? Once again, it could all be so simple with proper documentation, legitimate services, and honest billing. But when greed takes over, everything becomes complicated. Mr. Jesse, you know you can jump in however, whenever. So let's follow the money, the payment and billing pressures. Now let's talk about something that hits a little closer to home. And this is the United Healthcare situation and what it reveals about payment pressures in our industries. The Wall Street Journal reported that the Department of Justice investigators are questioning former UnitedHealth employees about Medicare payment practices. Specifically, they're looking at efforts to record specific diagnoses that generate higher payments and document lucrative diagnoses through patient testing and home nurse visits. We just talked about this. Anyway, what's concerning is that UnitedHealth isn't some small operation. This is one of the largest healthcare companies in America. If they're under scrutiny for their Medicare Advantage practices, what does that tell us about the pressure to maximize reimbursement in our current environment? United Healthcare stock has fallen nearly 40% this year. That's not just a bad quarter, that's a crisis of confidence. And when a major payer is under this kind of scrutiny, it affects all of us. This brings us to, well, did you want to say anything about them before I go into?
I just want to say, I mean, when are they going to just close and throw the whole thing away? Because I don't know if it's possible for them to dig themselves out of this, because it's just it's never ending with them. They are always in the middle of something, and it's never anything good.
It's crazy.
I don't even know how they would even begin. They would have to just get rid of their whole C-suite and start all over. And I don't know if that's possible in an organization. How you would even do that and still function.
Hell, sweet seat or a C-suite board, everybody. I don't know, because whether they want to pack it up nicely and on their terms and walk away, or they gonna get shut down one way or the other, it's not looking well.
It's not. I mean, and people are still complaining about, you know, not being fully compensated and still having issues regarding their breach.
Mm-hmm.
I mean, it's just out. They really are in crisis.
And then with them going after the physicians for the quote unquote loan that they, it's like, really? It's crazy out here in these streets. Lord, we, we need the prayer warriors need to be out here on the healthcare scene.
And this whole like, and I understand now why, because I was like, what is, there's always a reason behind these version changes. So I was wondering why. What was the real reason behind them going to version 28 for risk adjustment as opposed to version 24, which they used for a long time?
Mm-hmm.
So basically, because I'm like, because I was doing some more reading and I figured it out.
Mm-hmm.
Version 28 uh, cuts down or almost eliminates this need for this chronic condition chasing,
Mm-hmm.
because all they want to do now is just get a diagnosis so it can add to the RAF score. But now in version 28, there's almost no difference in payment versus a condition with no complications versus chronic complications, because it's more about severity. And
Okay.
I think they also got rid of, because after a person has so many HCCs, you get a little bump, and you can add this other number to the RAF score to increase it even more. So I think they've gotten rid of that too. So that also de-incentivizes this condition chasing.
Okay. Well, maybe they'll see some impact on the other side when they do some audits of, maybe to help eliminate some of the stuff that I always ask that don't even make sense, that they keep finding these same findings over and over again when they do these audits. It doesn't make
Right.
sense. Like
So,
the cancer and that this doesn't make sense.
and because what I was like, oh, okay, so but it all makes sense, because before somebody had their toe amputated, their left great toe amputated in 1972. You had to document it every year, and it was an HCC. It's not anymore. So they don't care about your 9 toes anymore.
Yeah. So yeah, so it's gonna be interesting. I'm surprised they're not screaming and hollering about the version 28. I mean, you heard a few blips when it first came out, but I'm surprised. And maybe they haven't. Maybe the information or things haven't hit them yet on the changes and what that means to them and their bottom line. Maybe that's what it is. I don't know.
You, I've been telling you since we started this. Well, since I joined your podcast, look, risk adjustment has always been a fool.
Mm,
Always. And
mm,
it doesn't have to be, but people don't want to listen.
like,
But they
no, it's you they giving you these extra little things. Just take what they give you. Stop being greedy.
and just document what's really going on. Like
What's really
it,
going on?
it,
Don't
if you are if you are an MD, a DO, a NP, a PA, you cannot tell me that you struggle with the difference between active cancer and a history of.
You
You
don't,
can't
you
tell me
know the
that.
difference. You
Right.
know the difference because your focus is going to be different on how you treat that patient, the
That's
care that you
right.
provide. So miss me with that. That's
Exactly.
foolishness. But anyway, okay. So okay, so this brings us to our surgeon payments, which are now squarely in the crosshairs. The um, HHS Office of Inspector General just completed an audit that's putting surgical global periods under the microscope. So for those working with surgeons, lean in, lean in. Global periods are fundamental to how surgeons get paid. The payment covers the surgery plus all related care for either 0, 10, or 90 days post-operatively. CMS uses data from the surgeons to determine average time spent and number of follow-up visits to set these payment rates. Well, the problem is the OIG audit of 105 surgeries found that the actual number of post-operative visits was significantly lower than what CMS uses to calculate the payments. Now, any one of us could have told them that most total knee replacement patients don't stay in the hospital for 3 days anymore. But that's beside the point. The real issue is that CMS is now under pressure to revisit how they determine visit frequencies. And that could lead to reduced payments for many surgical procedures because all of that is bundled into the price. If you're working with surgeons, you need to understand CPT code 99024, the no pay code that reports post-operative visits during the global period. Your surgeon should be using this code to document every post-op encounter because the data goes to CMS and affects future payment calculations. What we're seeing across the board is increased scrutiny of payment methodologies, whether it's Medicare Advantage risk adjustment, surgical global periods, or documentation requirements. Every aspect of how we get paid is being examined with a fine-tooth comb. I got a visitor, sorry. Uh-oh. It could all be so simple. It could all be so simple. See, the patient document the visit, bill appropriately. Period. Boom, boom, boom. But when payment pressures mount, some people start looking for shortcuts, and that's where trouble begins. Again, the message is clear. The days of close enough are over. Every code, every diagnosis, every visit needs to be precisely documented and absolutely defensible, or you're going to find yourself in trouble, trouble, trouble. Let's talk about the double-edged sword that is technology in healthcare today. On one hand, we have criminals using artificial intelligence to create fake patient consent recordings. That just threw me out. On the other hand, we have the Department of Justice using advanced analytics to catch them. The criminal side first. One of the schemes highlighted involved, again, defendants using AI to create these fake recordings of Medicare beneficiaries supposedly consenting to receive certain products. Now, think about how sophisticated that is. They're just not stealing identities, they're creating believable audio evidence of consent. I remember this was recently, somebody was saying if somebody, something about, and they were targeting elderly people and telling them when people on your phone, don't just say yes on your phone. Something about saying yes when people call you. And I guess they knew. And I don't know if this was a state or federal conversation or PSA to our seniors, but they just kept saying, you know, how you're talking to people and you don't get an immediate, like you're like, hello, hello, yes, hello, hello. Don't do that because they're recording your voice at that point to then potentially, allegedly, recording your voice at that point, or could be recording your voice at that point to use it. I remember that came out. And now that I see this, I was like, oh my God, really? This is what we're doing?
Hmm.
Wow. So again, this is happening in telemedicine fraud as well. Department of Justice charged 49 defendants in connection with over 1.17 billion in fraudulent telemedicine and genetic testing claims. These schemes often involve deceptive telemarketing campaigns targeting Medicare beneficiaries. But here's the flip side. The good guys are fighting back with even better technology. The Department of Justice new Healthcare Fraud Data Fusion Center is leveraging cloud computing, artificial intelligence, and advanced analytics to identify emerging fraud schemes. Their data analytics team, which was established in 2018, is getting more sophisticated every year. I mean, but you got to fight because the criminals are getting sophisticated too. But anyway, what does all of this mean for legitimate providers? Well, it means that unusual billing patterns are going to be flagged faster than ever before. If your practice suddenly starts billing significantly more of certain procedures, or if your documentation patterns change dramatically, you're going to show up on somebody's radar. The key is consistency and legitimacy. Technology can spot anomalies, but it can also validate legitimate practices. So if your billing patterns are consistent with your patient population and your documentation supports your claims, technology actually will work in your favor. For telemedicine specifically, make sure you understand the requirements for legitimate telehealth services. The convenience of telemedicine has been a game changer for patient care, but it's also created opportunities for fraud. So document the necessity of the service, ensure proper patient consent, and maintain records that would satisfy any audit. My advice: embrace technology for compliance, monitoring in your own organization. So use your practice management systems to identify outliers in your own billing. Again, if something looks unusual to you, it's going to look unusual to enforcement agencies too. And honestly, it could all be so simple. Use technology to provide better patient care and maintain compliance, not game the system. Mr. Jesse.
It I just cannot. First of all, what gets me is, you know how many claims you have to have from Medicaid to get to $1.17 billion? That's not 10 claims. That's a lot.
That's a whole lot. A whole lot. Oh,
It's wild out here.
wow, in these streets.
And I had seen another story. This was in New York. A husband and wife couple. They got charged with $60 million in false claims.
Mm-mm-mm.
They were around there falsifying records. I'm like, this is craziness.
This is crazy.
Like,
Crazy.
and the thing that people don't understand is, like, the way CMS is set up, they'll let you get away with it.
Oh,
They'll
absolutely.
they will pay you, but they're
Pay
gonna come
you
back
and
and
hit you.
scrutinize. Yes.
And hit you. Now, let's talk about something that often gets lost in all the numbers and enforcement actions, and that's the human cost of healthcare fraud. Because ultimately, this isn't just about money, it's about people. The Department of Justice specifically highlighted cases involving vulnerable populations. We're talking about elderly patients, many receiving hospice care, who were subjected to medically unnecessary procedures. In one case, defendants targeted vulnerable elderly patients and applied amniotic wound allografts without coordination with treating physicians, often to superficial wounds that didn't even need treatment. Consider this for a moment. These are people in their final stages of life, and instead of receiving compassionate, appropriate care, they're being used as billing opportunities. That's not just fraud, that's a fundamental violation of our duty as healthcare professionals. The scheme involving substance abuse treatment is equally heartbreaking. Defendants allegedly preyed upon vulnerable individuals in need of addiction treatment, billing Arizona Medicaid $650 million for services that were either never provided or were so substandard they served no treatment purpose. They recruited patients from homeless populations and Native American reservations. Again, what this tells us is that fraud doesn't just steal money from government programs, it steals hope from people who need help the most. When someone seeking addiction treatment receives substandard care because a provider is focused on maximizing billing rather than providing treatment, that person's life is at stake. For those of us in legitimate practice, this is why compliance matters so much. It's not just about avoiding penalties. It's about maintaining the integrity of our It's about maintaining the integrity of our profession and ensuring that resources go to patients who truly need care. Every fraudulent claim takes resources away from legitimate patients. Every scheme that exploits vulnerable populations erodes public trust in our entire healthcare system. It's already, I mean, it don't take much, but it could all be so simple. Provide the care patients need, again, document it properly and bill for what you actually do. Do you see the pattern there? But when profit becomes more important than patients, everything goes wrong. And when we talk about compliance and fraud prevention, we're not just protecting our organizations, we're actually protecting our patients and our profession. So let's shift over to where all of this is heading, because understanding the enforcement landscape is crucial for planning your compliance strategy. First, the scope is unprecedented. The Department of Justice's healthcare fraud strike forces operating in 27 districts now have charged more than 5,400 defendants who collectively billed Medicare, Medicaid, and private insurers more than $27 billion since 2007. That's not including this latest takedown. But what's really changing is the sophistication. The new Healthcare Fraud Data Fusion Center represents a fundamental shift in how enforcement works. Instead of separate agencies working in silos, we now have the Department of Justice Criminal Division, HHS OIG, FBI, and other agencies sharing data and analytics in real time. So this implements the president's executive order on eliminating information silos. Ma'am, stop touching my equipment. What that means practically is that unusual patterns in your billing are going to be visible across multiple agents simultaneously. You'll get your shine on the meeting after the meeting. Chill out. um, there's nowhere to hide these inconsistencies because everybody's eyes are on everybody. The international cooperation is also escalating. 4 defendants in the recent takedown were arrested in Estonia through international law enforcement cooperation. 7 others were arrested at U.S. airports and the border with Mexico as they tried to flee. This isn't just domestic enforcement anymore, it's global. And for legitimate providers, here's what you need to know. We can't say this enough, but first, documentation is everything. The days of we've always done it this way, they've been over, but they are really, truly over. Every service needs to be documented as if it's going to be audited because it might be. Second, stay current with requirements. The recent articles mentioned new discharge planning requirements that went into effect July 1st, mid-year implementation of new conditions of participation. Survey organizations are going to be eager to catch hospitals that miss these deadlines. Third, monitor your own patterns. If you're seeing unusual spikes in certain procedures or diagnosis codes, investigate internally before someone else does. Use your data to identify potential issues. Fourth, train your staff continuously. The schemes that we're seeing involved licensed medical professionals, doctors, nurse practitioners, pharmacists. Education and ethical training aren't one-time events anymore. They need to happen on a regular basis. The enforcement agencies are also targeting specific areas more aggressively. Telemedicine fraud, genetic testing schemes, durable medical equipment fraud, and prescription opioid trafficking. If your practice touches any of these areas, you need enhanced compliance monitoring. Looking ahead, I'll expect we'll see even more sophisticated enforcement tools, increased penalties for noncompliance, and greater coordination between these agencies. The government has invested heavily in fraud detection technology, and they're seeing returns on that investment. But here's the opportunity. Organizations that proactively implement strong compliance programs, that use technology for internal monitoring, and that maintain excellent documentation practices are going to thrive in this environment. The increased scrutiny is actually going to benefit legitimate providers by leveling the playing field. Because really, it could all be so simple when everyone plays by the same rules. Now, before we wrap up, and Mr. Jesse, did you have anything you want to jump in?
I just wanted to jump in and say the government is getting ready because, one of the other things that has been announced is another joint task force
Mm-hmm.
with the between these healthcare organizations, and it's specifically focused on DME.
Mm-hmm.
And then I also saw on I want to was it Indeed or LinkedIn, one of those places, the FBI is looking for a special agent here in Philadelphia that has a background in health and medical. So, they're ramping people up to come after who they got to come after.
Right. Hey, Dr. Jasmine. She said enhanced compliance monitoring might be an expanded entrepreneurial opportunity. Could you say that again for the people in the back? For HI professionals, because this is about to change everything. You are absolutely correct. Absolutely correct. Okay, before we wrap up, let me address some key questions that you might be asking. So, how can legitimate providers protect themselves? Well, implement proactive compliance monitoring, use CPT code 99024 for post-operative visits during global periods, document medical necessity for every service, train your staff on evolving requirements continuously, and monitor your own billing patterns for anomalies. What's the difference, or what's the balance between fraud prevention and access to care? This is crucial. We can't let fraud prevention create barriers for legitimate patients. The key is precise documentation and appropriate utilization, and not restricting access, but ensuring services are medically necessary and properly documented. Are current enforcement methods effective? Well, look at the numbers. The
No.
numbers suggest yes, there's 14.6 billion in a single takedown with 245 million in assets seized. But more importantly, the deterrent effect is significant. When providers see these enforcement actions, it changes behavior across the industry, or at least it should. What role does corporate culture play? Everything. The organizations that are thriving have cultures of compliance, not cultures of maximizing revenue at any cost. Leadership sets the tone, and that tone has to prioritize patient care and ethical behavior over short-term financial gains. And the crazy part is, I mean, we all know and have heard there are a lot of these systems that are in dire straits financially. Now it's not the time to try to be creative and try to play them games on how to do some things differently. Now is not the time at all. So what
It's
I
really
want,
not.
no, it's not. What I want you to take away from today's Saturday morning tea is, of course, first, this is not the time to panic. It's the time to prepare. The enforcement landscape is changing rapidly, but organizations that prioritize compliance and patient care are going to not just survive, but as I mentioned before, they're going to thrive. Second, documentation is your best friend. Lord, we've said this for years, for decades. Every service, every diagnosis, every decision needs to be documented as if your auditor is sitting right next to you. Because in today's data-driven enforcement environment, they essentially are. Third, stay informed and stay connected. These changes are happening fast, and isolation is your enemy. And whether it's through us at the Professional Reimbursement Network, our Saturday morning tea, industry associations, or trusted colleagues, you need multiple sources of current information. Stay in the know. Here's what I need you to do this week. Schedule a compliance review meeting with your team. Review your documentation policies. Are they current? If you're providing surgeries, check if you're using CPT code 99024 for post-operative visits, and verify your discharge planning protocols to make sure that you're meeting the new July 1st requirements. Yes. I was just saying, oh yes, this is serious business. Absolutely. It's serious. Absolutely.
I have just never understood why. Well, I do know why, because the real why, especially because, okay, so what I think is going to end up happening is there's going to be so much pressure put on these doctors and these health plans. It's going to start to trickle down to coding and billing sooner rather than later. They're going to take everybody down, because these doctors are not going to go down by themselves. That's not going to happen. And it's long overdue, because the bottom line is, I have said it all the time, like, we coders want to, and billers and all these people in HIM that have credentials and certifications, you want to fight for respectability. Well, guess what? You can lose it. Just like you can as a nurse, because
Just like that.
I protect my nursing license, because that's how I eat. And I do the same thing with every one of my coding credentials. That's how I eat.
Absolutely.
So I'm not coding no foolishness. I'm not going along with no nonsense. You're not gonna tell me it's up when it's down.
Absolutely.
And you have people who do that all day long. I've told you before, I've had been in interviews and with senior people who are totally clueless and standing 10 toes down in it, because nobody has ever told them that they're wrong. But And I think also what they need to do is, if they really want to cut down on fraud, they need to increase the amount of money that people recover for these key tam lawsuits and make it easier for. I'm serious. I think they need to up that percentage.
You get a whistleblower settlement. You get a
There you
whistleblower
go.
settlement. Everybody. Yes, and in those particular veins, as well, if you're seeing some things and you're documenting, make sure you document all the things. If you see some things that look a little shady, and you go and you tell the folks, hey, you know what, I saw XYZ and it's not adding up to ABC, and nothing is moving and shaking, make sure you have some documentation about what you're seeing and who you told and why things didn't move and all other things that'll help in these times as well. How about that? Documentation is good all around for
All the
everybody.
time.
For everybody. All right. Well, if you found this information valuable, and I know you did because you're still here with us, let me ask, was the tea spilled today? Put your teacups in the chat. And also, please hit that like button and subscribe to our channels. Your engagement helps us reach more healthcare professionals who need this critical information. Also, share this episode with your colleagues, especially those in surgery, coding, billing, and compliance. You can also forward it to your medical staff, presidents, CEOs, CFOs, your compliance officers, your revenue cycle directors, all of the people who really need to know this information. In the event, they brush you off, share it with somebody so they can hear it from somebody else. Be like, I didn't make this stuff up. I really didn't. Again, this information could literally save someone's career at their organization. So, did you want to say something?
No.
I heard you breathe. Okay. Join our community of professional reimbursement at Professional Reimbursement Network LLC. We provide ongoing education, compliance updates, and practical strategies for navigating this complex environments. You don't have to figure this out alone. And that'll just bring me to our little slide. Yay. So are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the PRNT sippers, really, Zora? You want to be one? You want some tea? You'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. And here's what you can expect as a valued member of the PRNT Sippers: exclusive healthcare insights. So gain access to in depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry. Personalized support. Give me that. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth because, as we always say, it can all be so simple, and we can break that right down for you. And then my favorite, community connection. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you in advance for considering becoming a member of the PRNT Sippers. Come on over. For the cost of 2 cups of regular tea, you can join the community. Check out the link in the description of the video or go to bit.ly/the PRNT Sippers for more information. Again, your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. Yes. All right, all right. So for our Saturday morning tea family, thank you. Thank you for spending your Saturday morning with us. We know your time is precious. Some of y'all just barely wiping your eyes, rolling out the bed. We get it. And we don't take it lightly that you chose to spend your time here with us. And so at the Saturday Morning Tea, we're all about building a community of savvy, informed, marketable healthcare professionals. So again, like, share, subscribe, and comment, and let's grow this community together. Mr. Jesse, do you have any closing thoughts?
This is going to be an evolving situation, and people need to align themselves now to be ready to take advantage. Because the government means business,
and
they're not playing.
If what we saw this past week or over the last couple of weeks is any indication, we're gonna be on swivel. Our head's gonna be swirling because it's like, what? They did who? They found what? What people doing? And I'm like you, I'm waiting, sitting back to see what the key tam landscape about to look like. Because in my spirit, I believe it's about that's gonna be the new win.
Because
go ahead.
Because what I also want to know, we're going to have to find somebody on the federal level, because what I want to know is these claims that are being fraudulent.
We came back to this lady had a plant sale. Oh.
Go ahead. I'm not even listening to her right now. Go ahead.
what the information I want to know is like these claims that are being submitted, that are fraudulent. I want to know, are they being submitted domestically or offshore? From offshore billing companies. That's a whole lot. That's a whole nother avenue we got to go down.
That's you know what? That's the case right there. And the things the folks don't want to talk about. But again, that's all in this creative workflow and creative environment on how to get things done. It may not be as creative as you think. All righty. Well,
and also, and if they are offshore, how could the DOJ come after them?
That's true. But to this particular enforcement, they have some international players assisting them. So if they're building these international bridges, there may be opportunities there. But again, if they're not as savvy or don't have it's going to be interesting. I'll say that. I'll say that it's going to be real interesting, especially pointing the finger and passing the buck and all of the things. Like, well, y'all over there and y'all told us, and this is what y'all told us to do, and we just following what y'all said. It's gonna be a whole hot, nasty mess if that ever comes to light. If things are happening in those areas. All right. Well, again, compliance isn't just about following rules; it's about protecting the integrity of our profession and ensuring that healthcare resources go to the patients who need them most. When we do this work right. Boy, everybody got to talk. Everybody wins. So tune in next week as we'll be discussing another hot healthcare informational topic you won't want to miss. See you PRN tea sippers at 10:15 a.m. with our other special guests over here.
Look, I would get ready to tell her, look, that line, what's that famous line? Ain't nobody come to see you, Otis.
Ain't nobody come see you, Otis. Whatever. She like, whatever. Again, I'm Clarice Warner, the girl with the pearls, with my partner in success, the coding nurse, reminding you that in healthcare, knowledge isn't just power, it's protection. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. See you later. Have a good weekend.